Hi and welcome back to my channel. Today I'm going to talk to you about the 5 top things for me about gastric sleeve surgery and what I think you should know and understand a little bit about before going ahead with it, or not before going ahead with it, just to have it in your mind and do a little bit more research just to give you a better understanding. So the first one is for me, I'm going to look at my notes. So I had my nurse's appointment and the first one for me was constipation. Given my medical history over the last few years, constipation and, bowel movements are quite important to me. Hey, and so, and they're important to everyone, I suppose, but for me, medically, I need to make sure that I am regular. So this is number 1 for me, is constipation. And the reason why that you're more at risk of constipation is decreased intake, decreased fluids, lack of mobility. So there's a list of reasons why you could be constipated. Medications, if you're taking pain medications, especially anything other than over-the-counter medications, that can increase your risk of constipation. So please be mindful of that. So if you're taking an endone, anything with codeine in it, your risk of constipation will go up. And just be aware. That's really important, because I know somebody who ended up back in hospital 2 days after being discharged because she had severe constipation and she needed medical intervention, like from surgeons. So that's something to definitely keep in mind. So before you start taking, like, there's the Movicol, there's Coloxylin Senna, there is lactulose, and there's the powder, like fiber supplements you can take. Before you can actually start taking them, you need to be having at least 1 liter of fluids in a day. So when I spoke to my nurse, because I'm already taking the fiber supplement, the reason why I started to take it is because I wanted my body to get used to it, because what it can do is it can cause some bloating and gastrointestinal discomfort if you're not used to taking fiber supplements. So it's best to sort of start before your surgery, just so your body can adjust to it, so you can understand the feeling that you're feeling and how you can navigate around that. Number 1 is, if you're having bloating and discomfort from the fiber supplements, is just to drink more fluid, because what the fiber supplement will do is it'll draw in the fluid. So that's number 1. And so what I'm going to do is, I was talking to my my nurse. Sorry, my battery light just started flicking. That's why I went a bit off track. So what we're going to do is, for me, is in the mornings, I'm going to drink my fluids as I normally will. For that first week is going to be a lot of trial and error with fluids, but what I'm going to do is I'm going to drink them in the morning, my normal fluids, free fluids with nothing in it. And then in the afternoon, so after lunch, I'm going to do Hydrolyte, or you could use Hydrolyte, you could use, like, there's a hydration IV, you could use like Gatorade or any of those sports drinks that help you hydrate more than regular fluids, water. And I'm going to add my fiber supplement in that. And then after that, I'm just going to go back to free fluids. I am going to aim for 1 liter in the initial days. I do drink 3 liters of water a day, so this should be interesting to reduce it by 1/3. But it's all trial and error, and I just take 1 day at a time and just keep sipping water. That's what they say, just keep sipping. So that's what I will be doing. If you find that you haven't been to the toilet to open your bowels for a few days and you are having increased pain and discomfort, and you're not passing wind, there's that's a reason to call your surgeon, go to your GP, go to hospital, tell them what's happened, because it could be a sign that something more serious is happening. Okay. Alcohol dependence. This was something that I found out a year ago when I was talking to a family member who had a friend that had the surgery, and because they used food as comfort before the surgery and they couldn't do that after the surgery, they then turned to alcohol. This was raised to me by the nurse, is just to be mindful of that and be mindful of your triggers, and if you can't go for food, that what are you using to replace that. That's why I recommend also seeing a psychologist or a behavioral therapist, somebody to help you understand your eating, your triggers and things like that as well alongside the surgery, just to ensure further success. Now, when I was looking at the studies of the prevalence of it, there was some that said there wasn't any studies, and some that I read that the increase can be up to 30% post 30% alcohol dependence post bariatric surgery. So that's definitely something to be mindful of. And if you are finding that you are drinking, you're turning to alcohol, and just have that in your mind that could be, that could be something else. Also, if you are drinking alcohol, they have told me just to be careful, because if you drink maybe 3 glasses of wine of an evening, half a glass of wine might be your max after the surgery. And I was told not to even to consider alcohol for at least 3 months, and then just to go how I'm feeling afterwards. Reflux. So while the gastric bypass is suitable and recommended for patients with reflux already, I cannot have that due to my past medical history, so I am having the gastric sleeve. The gastric sleeve can increase your risk of reflux post-surgery if you never had it before. Just be mindful that you may be at risk of having it reflux afterwards, and this is just because your stomach size has been decreased significantly, and it just puts more pressure it just puts more pressure on your stomach, and it can exacerbate reflux. So I already take medication for reflux, and I have a hiatus hernia. So my surgeon is confident that once the hiatus hernia is fixed and I've had the sleeve, that I will swap over my medication, and within 6 weeks, she's planning for me to go off my medication completely. However, if my reflux does return, it's really not a big deal for me, because I'm already on medication. So it makes no difference at all. Fertility. So I thought this was really, really interesting. So when they cut out your stomach, what it does is it resets your metabolism. It resets that, I can't think what it's called, but it resets the message, like those cravings and that, not the food voices or the talking in your mind, but it resets that, the message to your stomach, to your brain about wanting food. And what it also does, it resets your hormones. Well, it doesn't reset your hormones, it stirs them up a little bit. So this means that your risk of, your fertility can increase significantly post-bariatric surgery. So you cannot rely solely on the contraceptive pill, as that's due to absorption, and they recommend using other means of contraception alongside it if you still want to take a contraceptive pill. Also, your cycle may be a bit funny after your surgery due to the hormones being reset and sort of messed up a little bit. So that's something else to keep in mind. And having children or trying to conceive after bariatric surgery is still considered safe, but they do recommend waiting 12 months post, just to make sure that you are having adequate diet and there's no vitamin deficiencies, nutrition and vitamin deficiencies. And the last one is steroidal NSAIDs. That's what they are. Non-steroidal anti-inflammatory drugs. Non-steroidal. Why can I not say that? Okay, so medications considered as NSAIDs. So I'm not even going to say it, because for some reason the word steroidal is not coming out properly. So it's non-steroidal anti-inflammatory drugs. Okay, I've said it. Such as ibuprofen, Nurofen, Advil, I think there's a few other names, aspirin, diclofenac, naproxen. These can be purchased over the counter. They're not recommended in the first, well, for me, the nurse said the first month post-surgery, but unless you need it and unless you can't find an alternative that is equally as effective, I would suggest just staying off them completely, because what they can do is they can irritate the stomach and cause bleeding. So it also gives you a higher risk of gastric ulcers. So if you're having the gastric sleeve, I would just avoid it completely, because you've got this new stomach, it's smaller, acid reflux may be an issue, then you're going to add these medications that can potentially cause, you know, the lining of your stomach to bleed, you know, increased risk of stomach ulcers. I think just, in my opinion, it's better to be safe than sorry, and just to sort of stick clear of them unless you desperately need them moving forward, but allow for your stomach to heal before that. So that was that for me, and I just really, I just thought they were important. I just thought they were the 5 things that aren't really talked about a lot. Well, they are, but they're not really. The constipation one, I was speaking to someone who had the bypass and they didn't know that constipation was going to be an issue, which was really, I don't know, it was really sort of frustrating to hear. Fertility, that's a great one. I think that's really encouraging to hear. You know, if you are overweight, if you know, for whatever reason, and you know that you need to lose weight, and you know, you've struggled all your life, but you want to have children, to know that this can potentially have a positive effect on your fertility, that's something also to look into. And I just thought that was really, really encouraging. So, and the alcohol dependence, so just be mindful of that. If you do use food as emotional, you know, comfort, if you're triggered for whatever reason and you take, and you consume food, that alcohol may be your next go-to, so just be mindful of that. And if you can, just seek help if you are finding like, or keep a diary. That's another thing too. Keep a diary about how you're feeling that day, and if you wanted to eat and you couldn't, so what did you do instead, and see if a pattern is starting to form. So I am, as I said, 48 hours from having my surgery. I'm so nervous. Really nervous. I'm worried that something's going to go wrong. I think everyone thinks that. I'm not a good patient anyway, so that should be fun for the medical team. And I'm first on the list, so I'll go in about 8 a.m. and then I will do some video updates on my phone, and the quality is not going to be any different to on the camera, to be honest. What happened? I don't have any, baby. This child wants ice cream. My children are obsessed with ice cream. Okay, I'm going to go because he's going to lose his tiny little mind. And I want to say thank you for watching. And the next video I will be post-op, and I will update you on my phone. I am on TikTok and Instagram, and I will link them down below in my descriptions. Thank you again for watching. I look forward to sharing this journey with you all. And if you have any questions, please don't hesitate to ask. And I will see you soon. Thank you for watching. Don't forget to like and subscribe. Bye.